This PowerPoint contained the information about the cystic fibrosis. Cystic fibrosis is a genetic disorder that causes the thick mucus secretion and obstruct the organ like pancreas, lungs, liver, and small intestine, even reproductive organ. So the key point here, we said it is the genetic defect. The gene is called CFTR gene. And excess secretion of the mucus, and this mucus is thick, sticky mucus, and they causes the blocking of the lungs. So in the picture, you can see because of excess secretion, the respiratory tract is blocking. Same obstruction occur by the thick mucus in pancreas and small intestine and reproductive organ. Thick sticky mucus block the pancreatic and bile duct. Everybody know pancreas secrete pancreatic amylase, very important for protein digestion. But if the pancreatic duct is blocking, it does not secrete the pancreatic amylase or pancreatic lipase. And in the second part of duodenum, let me read it. Cystic fibrosis is a chronic multi-system disorder. So involve lungs, pancreas, intestine, and organ, reproductive organ. So multi-system get in, and it is autosomal recessive. What does it mean? Defective gene CFTR must carry parents, mother and father, both transmit the defective gene. Unfortunate mate. Autosomal recessive trait that is characterized by exocrine gland dysfunction, like pancreas is an exocrine gland. So if I ask you, what are the risk factors? What are the risk factors? The risk factor, both biological parents carry the necessary trait for cystic fibrosis. The mucus product produced by exocrine gland is abnormally thick and copious, which causes the obstruction of the small intestine or passageway of affected organ, particularly respiratory organ, gastrointestinal, and reproductive system. The common symptoms are associated with pancreatic enzyme deficiency and pancreatic fibrosis caused by duct blocking, and also progressive chronic lung disease as a result of infection, and sweat gland dysfunction result in increase the sodium and chloride sweat concentration. So this is the common problem in the patient who have the cystic fibrosis. In this picture, we can see the lungs, because of too much sticky secretion of mucus, patient develop the chronic lung problem. Right? So when the chronic lungs disease developed, when you put the stethoscope over the lungs, you can get wheezing or patient complain the coughing, shortness of breath, and mucus plug formation. When our lungs does not carry or does not functioning well, patient develop deficiency of oxygen. We called cyanosis developed. Like this picture, cyanosis developed. Blue discoloration the tip of the finger, mucous membrane, lips. Patient has a barrel shaped chest and also clubbing in the finger because of the chronic lungs disease, or even clubbing fingers develop if patient has a chronic heart problem. In case of GIT, we can see here what are the problem occur in GI. They said GIT, liver dysfunction, pancreas dysfunction, and also colon dysfunction. Patient has a abdominal distension, decrease the digestive enzyme, pancreatic lipase, pancreatic amylase, enzyme reduce, rectal prolapse, fatty sticky stool we call diarrhea, means stool mixed with fat. Also meconium ileum in the newborn. So loose fatty malodorous stool is a characteristics of cystic fibrosis. Sometimes delay the growth, weight loss, fat soluble vitamin deficiency is most common, right? So if patient have a fat soluble vitamin deficiency or decrease the absorption of vitamin and enzyme, we should give them fat soluble vitamin. In the intestine, intragumentary system or cutaneous system or skin, we can see the salty taste. So when parents kiss their baby, they complain salty taste because high sodium chloride content in sweat, in saliva or tear. Excess salty materials came out, right? So let me go back here. So in this page, talking the various effect of exocrine gland dysfunction in cystic fibrosis. Basic defect, exocrine gland. Exocrine gland means pancreas, sweat gland, abnormal mucus secretion and obstruction. And this mucus is thick, sticky. Bronchi problem, patient develop bronchial obstruction, which lead to chronic bronchial pneumonia or generalized obstruction, and patient develop emphysema. Bile duct, focal biliary fibrosis, which concentrate the biliary cirrhosis, patient develop portal hypertension. Pancreatic duct, secondary degeneration of pancreas or pancreatic chyme, also malabsorption syndrome develop. Small intestine, increase the meconium and intestinal obstruction of the newborn. So this is the consequence and complication arise because of cystic fibrosis. What we learn from here? We see cystic fibrosis get involved our lungs, involve biliary system, involve pancreatic system or pancreas, and small intestine as well. What next? And this is the picture. You can see lungs, upper respiratory tract. Here showing normal, healthy trachea, and lumen is wider. In case of cystic fibrosis, too much secretion, what is sticky and causes inflammatory change, right? So here we can see the lumen is narrower and increase the mucus secretion and causes inflammation and narrow the pathway and patient problem, respiratory problem, shortness of breath in case of cystic fibrosis. In this picture, we can see left and right lungs, and one side we are comparing with other side. Because of thick, sticky mucus secretion causes the blocking in the trachea, tracheole, and alveoli. Here showing the mucus is accumulate inside the lumen in case of cystic fibrosis. What else? An increase in sodium and chloride in sweat and saliva and forms the basis for diagnostic test. And sweat chloride, we call sweat chloride test. So if I ask you, so how we diagnose the cystic fibrosis? Sweat chloride test, right? Cystic fibrosis is a progressive and incurable disorder, and respiratory failure is a common cause of death. Organ transplant may be an option to increase the survival rate. Respiratory system, the symptoms are produced by sticky, thick mucus in airway, which lead to bacterial colonization and destruction of the lung tissue. So this sticky secretion, when accumulate and bacteria or virus come from the air in the respiratory tract, they fall in stuck and the multiplication of there and we call colonization, and patient develop emphysema or atelectasis occur at the airway, become increasingly obstructed. Same picture we're showing here. Mucus accumulate, lumen getting narrower in case of cystic fibrosis, and here showing blocking. The what other complication in case of respiratory system? Chronic hypoxemia means less oxygen in the blood causes the contraction and hypertrophy of the muscle fiber in the pulmonary artery and arterioles, thus lead to pulmonary hypertension, eventually develop the core pulmonary. So because of cystic fibrosis, patient develop the chronic lung disease and tissue do not get enough oxygen, but our body has a compensatory mechanism. Your heart will try to give more oxygen, so heart pumping action will increase, but problem is inside the lungs, but heart is working like a donkey, right? So when heart is working too much and hypertrophy occur in the cardiac muscle, dilated and hypertrophy of right ventricle. Because of non-stop working, hypertrophy develop, lumen get narrow, and patient develop heart failure. So core pulmonary develop. What is core pulmonary or right-sided heart failure is an enlargement of right ventricle due to high blood pressure inside the lungs, and also usually causes by the chronic lung disease. So heart problem develop because of lungs problem, we call core pulmonary. Also other complication like pneumothorax, which is the respiratory emergencies, pneumothorax or rupture the bully, and hypohemoptysis. Hemoptysis means the cough mixed with blood, right? Or blood mixed with cough. Hemoptysis from erosion of the bronchial wall. So respiratory illness develop basically, right? Even patient develop bronchiolitis, patient develop pneumonia, and patient develop the other complication like epiglottitis or influenza. What are the sign and symptom? If you put or examine the lungs, we can wheezing, patient complain the cough, shortness of breath, dyspnea, less oxygen to the tissue, blue discoloration, cyanosis, like this picture, clubbing in the finger and toes, barrel-shaped chest, this is the clubbing. Also repeated episode of bronchitis and pneumonia, right? So if patient develop the bronchitis or pneumonia, we must correct it. And bronchitis means infection of bronchi or bronchioles, usually caused by respiratory syncytial virus. Patient present with fever, cough, rhinorrhea, or wheezing. If patient develop the pneumonia here, it is the infection of the lungs, often caused by streptococci or mycoplasma bacteria. But underlying cause is complication of by cystic fibrosis. It is showing here cyanosis, blue discoloration of the lips, and clubbing, and barrel-shaped chest. What are the change occur in gastrointestinal system? In this picture, you can see stomach, second part of duodenum, and then small intestine. In the second part of duodenum, the pancreatic duct met with the biliary system and make the common pancreatic duct open in second part of duodenum, and there are one valve is here, it is called sphincter of Oddi. When the problem or blocking is occur, that times the pancreatic amylase or lipase does not secrete in the second part of duodenum. So fat does not digest, protein does not digest, but your vitamin need fat to dissolve and reabsorption from the body, inside the body. Meconium ileus in the newborn is the early characteristic sign of cystic fibrosis. So intestinal obstruction developed, and that caused because of thick intestinal secretion, and signs include pain, abdominal distension, nausea and vomiting. Steatorrhea developed. What is steatorrhea? Frothy, foul smelling, fat mixed stool. Deficiency of fat soluble vitamin like A, vitamin A, D, E, and vitamin K, shortly called headache, and which causes easy bruising, bleeding, and anemia. Malnutrition that lead to failure of growth. Patient develop hypoalbuminemia from diminished absorption of protein because you need pancreatic amylase for protein digestion. And here's the blocking or pancreatic fibrosis occur. You tissue do not get amylase and protein digestion impairment occur. Rectal prolapse can result from large bulky stool and also increase the intra-abdominal pressure. Pancreatic fibrosis can occur and place the child at the risk for diabetes mellitus. What about the intragumentary system? As I told you, the sweat gland secretes too much sodium chloride through the sweat gland, right? So abnormally high concentration of sodium and chloride in the sweat, and patient report that the infant tastes salty when kids. Dehydration and electrolyte imbalance because too much sodium is expelled out. Chloride is expelled out through the sweating, so imbalance occur. Reproductive system can lead to delay the puberty in the female. Fertility can inherited by highly viscous cervical secretion, which act as a plug and block the sperm entry. Male are usually sterile as a result of blocking of vas deferens by abnormal secretion or the failure of abnormal development of ductus structure. So here showing the symptom what we already mentioned, and here showing the treatment and medication. We are coming treatment and medication later on. First of all, let me explain what are the diagnostic tests. So most important diagnostic tests are sweat chloride test. It is the gold standard test for cystic fibrosis. Let me print something in your mind about sweat chloride test. So usually diagnosed in neonate or throughout the newborn scanning program. Diagnostic tests are sweat test, which is a gold standard, or newborn scanning, which we call DNA testing test, or pulmonary function test, genetic testing test, and stool analysis. In the box, you can see chloride concentration less than 40 millimole per liter is normal. 40 to 60 is borderline, but if more than 60 millimole per liter, it indicates abnormal in case of cystic fibrosis. So what other tests might be observed or ordered? White blood cell count, glucose level, liver function test, pancreatic function test, oropharyngeal culture, and chest or abdominal radiography. Let me recap it here. Newborn scan may be done in some state or may consist of immunoreactive trypsinogen analysis, but most accurate is DNA testing, direct DNA analysis for mutant gene. Chest X-ray reveals the complication of lungs disease like atelectasis or emphysema. Pulmonary function test provide evidence of abnormal small airway function, or stool fat or enzyme analysis or stool analysis, also diagnostic test. And now, in a short, what are the treatment options? Treatment option basically, we give them diet, high calorie intake, high protein intake. We give them pulmonary therapy or respiratory chest physiotherapy, postural drainage, breathing exercise, and also aerosol therapy. What are the medication we give? Antibiotics, supplement vitamin, bronchodilator, mucolytics, and pancreatic amylase. So as I told you, in respiratory problem, if patient have, we give them physical or chest physiotherapy. Chest physiotherapy, use of percussion, vibration, or postural drainage. We say postural drainage. Also, breathing exercise to lose the respiratory secretion, so they can be cough up or suctioned it. So nursing care is important here. Schedule the treatment before the meal or at least 1 hour after dinner or lunch to avoid the vomiting. Also, we admit the bronchodilator or nebulizer 30 minutes to 1 hour prior to chest physiotherapy. Important for NCLEX board exam. So here, next, let me go. Here, something NCLEX board provide the book sender. We left some information from the center here about the sweat chloride test. So production of sweat is stimulated, and sweat is collected and sweat electrolyte and measured. Normally, the sweat chloride concentration is less than 40 milliequivalent and chloride concentration greater than 60 milliequivalent. Chloride concentration 40 to 60 milliequivalent is highly suggestive of cystic fibrosis. What is the intervention, other intervention, right? So as I told you, the respiratory system, we go for the chest physiotherapy, or we give them bronchodilator like albuterol, or anticholinergics like ipratropium bromide, or IV antibiotics to treat pulmonary infection, also oxygen. Let me read it. The goal of treatment include preventing and treating the pulmonary infection by improving the aeration, means we give them oxygen, remove the secretion like suctioning or chest physiotherapy, admin antibiotics for infection, admin bronchodilator like albuterol or anticholinergics ipratropium bromide. Monitor the respiratory status, including lung sound and presence and characteristics of a cough. The chest physiotherapy. So biopercussion and postural drainage, it is a more important. And chest physiotherapy may be prescribed to be done every day to maintain the pulmonary hygiene. It should not be performed before or immediate after the meal. So what is nursing care about this? We schedule the treatment before meal or at least 1 hour after meal to avoid vomiting. We administer bronchodilator or nebulizer, nebulizing the patient 30 minutes to 1 hour prior to the chest physiotherapy. Important for NCLEX board exam. Next. So, respiratory system, the mucus clearance device, sometimes we use that is facilitate the removal of mucus and may be prescribed or stored away from the small children because it is the device separate and still the ball poses to the choking hazard. So it is just it is good to keep away from the children, right? The device. Also, the handheld precursor or special based device that provide the high frequency chest wall oscillation may prescribe to help the loosen the secretion. But keep in mind, when you do the postural drainage or breathing exercise, that also loosen the respiratory secretion. So patient can be coughed up or suctioned. So continue. The child should be taught the force expiratory techniques to mobilize the secretion to expel out, right? Bronchodilator medication aerosol may be prescribed and medication open the bronchi for easily secrete out or expectoration. We never give them cough suppressor, very important. Medication that decrease the viscosity of mucus may also be prescribed. A physical exercise program with the aim of stimulating mucus expectation or establishing as effective breathing pattern should be instructed. Antibiotics may be prescribed or intravenous antibiotics may be prescribed and admin at the home through a central venous system. So antibiotics basically treat the pulmonary infection. Oxygen as needed may be prescribed during the acute episode. Monitor closely for oxygen necrosis because the child with cystic fibrosis may have a chronic carbon dioxide retention. And also lung transplant may be option, right? What else? The gastrointestinal system. So the child with cystic fibrosis require a high calorie, high protein, and well-balanced diet to meet energy and growth needed. Multivitamin and vitamin A, vitamin D, vitamin E, and vitamin K also administered. Monitor the body weight in relation to their age because chance of failure the growth. Monitor the stool pattern and also monitor the sign of intestinal obstruction. The goal of the treatment for pancreatic insufficiency is to replace the pancreatic enzyme. Pancreatic enzymes are diminished within 30 minutes of eating and administered with all meal and all snacks, but not given if the child is nothing by mouth state. What NCLEX board asks? NCLEX board asks what kind of food we should provide. We provide high calorie, high in protein diet, right? And also keep in mind, increase the fat intake to 40% of total calorie. And we provide the fat soluble vitamin. And also administer pancreatic enzyme like pancreatic lipase within 30 minutes of eating. What next? Gastrointestinal system. Continue. The amount of pancreatic enzyme administered depends on healthcare provider preference and usually is adjusted to achieve the normal growth and decrease in the number of stool 2 or 3 days. Enteric coated pancreatic enzyme should not be crushed, right? And monitor for constipation or intestinal obstruction or rectal prolapse. Monitor for the sign of gastroesophageal reflux and place the infant in an upright position after eating and educate the child to sit upright after eating. What are the other intervention? Monitor the blood glucose level for the sign of diabetic mellitus because cystic fibrosis patient has a chance to develop hyperglycemia. So we would monitor the sign and symptom of diabetes mellitus. We ensure adequate salt intake and fluid that provide adequate supply of electrolyte during extremely hot weather. Monitor the bone growth, monitor the sign of retinopathy or nephropathy. It is a complication. Kidney pathology or eye pathology. Provide emotional support to the parents, particularly when the child is diagnosed. Provide support to the child as he or she transitions through the stage of growth. Reinforce the teaching to the child and parents about the care involved and encouraging independence in the child to care of self, right? What else? What are the home care? So here, the home care involve education the parents and child about the all of aspect of care for of the cystic fibrosis. Inform the child, parents and child about the sign of complication and action to take, and also importance to follow up care in case of critical condition. Because your patient develop respiratory problem, patient develop gastrointestinal problem, patient develop intragumentary problem, patient develop reproductive problem. So we need a complete teaching how to deal with them. Inform the parents and child about the sign of complication. Also educate instruction to the parents to ensure that the child receive a recommended immunization on schedule. Also, annual influenza vaccine is important. Inform the child and parents about the Cystic Fibrosis Foundation and also the resources. An alteration of respiratory status can create the experience for both the child and parents at claim or reassuring nursing approach will assist in reducing the fear.